In its daily COVID-19 evening update yesterday, the Health Ministry announced a new cluster linked to a workers' dormitory in Tuas. This Tuas View dormitory cluster came after one of the new COVID-19 patients, confirmed yesterday, was linked to 5 previous cases.
It's the third straight day that a new dorm cluster has emerged after all dorms were declared free of the coronavirus last Wednesday. Last Saturday, a new cluster was found to be linked to Sungai Tengah Lodge in Old Choa Chu Kang Road. Then, a day after, Homestay Lodge at Kaki Bukit was also identified as a cluster.
To further discuss this issue of resurgence of cases in dorms, we're joined by health economist Dr Phua Kai Hong. Now, Dr Phua is an adjunct senior research fellow with the Institute of Policy Studies at the Lee Kuan Yew School of Public Policy. Dr Phua, welcome to the show. Doctor, in line with Singapore's safe reopening, safe management measures are in place at the work sites and dorms. So, looking at the current protocol, what and where could be possible gaps in which the workers are getting infected? Is it the implementation of safety measures, or the way the workers are segregated, or even the testing protocol?
I think all of the above. If we want to do an evidence-based approach based on what we know from science, we will have to take a comprehensive approach. I think the first issue is therefore in the test. The test to confirm whether they are fit to work, whether they are free of the disease. So essentially, what we will recommend will be to standardize many of these tests to have higher quality control, and therefore maybe have a second test, to confirm it. Not just the first test, which may miss the results, but then have a second test to back it up as well.
Right. Well, Dr. Phua, having previously declared that all the dorms are virus-free, is this resurgence then of cases a cause for alarm, or is it at the very least a bit of a setback in the efforts to clear these dorms?
Well, we cannot have a foolproof system in the ability to pick up 100% of cases. So we will try to reduce the errors as far as possible. So the first one is to look at the science, right, and to look at the accuracy, and to try to have quality control and to remove those errors as far as possible for the scientific test. Then the second part will be the human errors. The human errors, for example, how you collect the samples, whether you do the swabs correctly and whether it's deep enough, and then the timing of the swabs until the samples are analyzed in the lab. The timing must be reduced from the time you collect it until the time you actually send it to the lab for analysis, because the viral samples could break down within the timing. It is too long. So we have to reduce all those human errors and standardize it so as to make the tests more accurate, the results more accurate. But of course, then the third part will be the entire system, to make sure that all these behaviors and human errors will be minimized. We will have to ensure that the system will not provide perverse incentives for either the employees or the employers to game the system, right? To show that they are fit to work and they are clear of the disease, and then you rush them back to work. And then there will be a trade-off between them picking up, passing on the infections as well, and then it will lead to a community infection. So there's a trade-off between their livelihoods and to lower the cost, as well as to lower the social costs and to reduce the risk of transmission.
Great sharing there. Very valuable insights indeed. Thank you so much, Dr. Phua, for setting aside time to speak with us. We were speaking to health economist Dr. Phua Kai Hong, who's an adjunct senior research fellow with the Institute of Policy Studies at the Lee Kuan Yew School of Public Policy.